Hello and welcome to Cambridge Clinical and to this session on ranking type questions, the final of the 3 question types in the situational judgment section. These questions take the form of 1 scenario and 3 suggested courses of action. Your job is to choose the most appropriate and the least appropriate of the 3. So we'll get on to some examples of these questions in a minute, but first of all, here are some quick tips to help you out. First of all, these questions are arguably the hardest type of the 3, so please don't be afraid to flag them and come back. It's definitely worth taking your time thinking over the answers. Another really good idea is to try and identify specifically which ethical pillar or issue is being assessed. This is key because often there might not be an answer option that is directly inappropriate in itself. But if this is the case, you can then judge the answers based on how specifically they target a particular ethical issue. Third, try to eliminate the middle option. Unlike the other questions in the situational judgment test, these questions require you to get the most appropriate and the least appropriate in the right order to obtain any of the marks. So one way to ensure you do this is to get rid of one of the answers that's clearly somewhat flawed but not dreadful. If you do this right, you should then be left with 2 answers, the differences between which will be much more clear-cut. Finally then, if you really can't decide based on the content of the answers, sometimes the question writers at UCAT will give you a bit of a hint based on what verb they choose. We'll come back to this later on and you'll see what I mean. Here's an example of one of these ranking type questions. Chrissy, a first-year medical student, is on a hospital placement in the surgical department. During one of her routine ward rounds with a senior doctor, she realises that the senior doctor has recorded a prescription that was different from what was discussed with the patient, which could cause the patient confusion. The senior doctor has a reputation of reacting strongly when her authority is questioned. Choose the one most appropriate action and the one least appropriate action that Chrissy should take in response to the situation. So let's have a look at these 3 options. So number 1, after the ward round, ask one of the other doctors which medication they would prescribe to the patient. Number 2, inform the senior doctor that she prescribed the wrong medication during the ward round. And finally, number 3, confirm with the senior doctor which medication she wants to prescribe during the ward round. Now, why not pause the video now and have a go at solving this to find the most and least appropriate courses of action. Remember to try and use our tips from earlier. Now, this is a good example of a question where we can try and utilise that second tip from earlier, i.e. eliminating the middle option. Answer option 2 here, informing the senior doctor that she prescribed the wrong medication during the ward round, is what we might say is appropriate but not ideal. If you compare it to answer option 3, it's much the same course of action, but rather than confirming with, we are informing the senior doctor of something. And I think we could agree that's more likely to elicit this strong reaction which the doctor is prone to have. So we can probably say, therefore, that this is the middle option. Using another tip from earlier, that of trying to identify the key ethical pillars at play, helps to choose which out of 1 and 3 is the most appropriate. So the ethical pillars most relevant here are those of beneficence and non-maleficence, i.e. whether or not the patient is going to be confused or not. Given that in this case time is of the essence, option 3 is the most appropriate, as it is done during the ward round. Given that answer option 1 is taking place after the ward round, there's much more time for harm to occur and for confusion to build. Therefore, even though it's not totally inappropriate in itself, it doesn't tackle the ethical issue at play, which is why we can say it's the least appropriate. Just before we finish this video, I want to give you a few more examples of questions where you can use the 4th tip, looking at the verb, to help you when you're not sure which is the most or the least appropriate option. So in this example, I haven't put the full scenario here just to save time. But in summary, in this question, you're playing the role of a first-year medical student, and there's an upcoming paired project you're going to have to do, paired with someone called Quentin, who's another first-year medical student. Quentin has consistently been disagreeable and doesn't enjoy working in group things. The thrust of this question then is how you, as the medical student, are going to approach Quentin to try and do the best you can in this project. So you've got 3 answer options here. Now let's say you just cannot work out purely based on content which is the most and least appropriate. So instead of looking at the content this time, let's just look at the first words. So you can suggest something to Quentin, you can ask Quentin something, or you can explain to Quentin. Now in the UCAT, it's always the softer approaches that are better when dealing with fellow students. So using that logic then, the option which involves Quentin the most and is most cooperative, such as number 2 when we're asking him how he feels, is the most appropriate. And the option that is most authoritarian and bossy, which is explaining to Quentin, option 3, is the least appropriate. In this example, you're once again a medical student who is this time receiving feedback from a supervisor at the end of a placement. The supervisor first congratulates you, but then says that there have been concerns raised about the way you speak to patients, including that you've been rude and dismissive to them. So this question is assessing which is the best reaction to that news from you, the medical student. So let's again, for the sake of argument, say that you've read through these 3 options and based on content alone, you simply can't decide which is the most and which is the least appropriate. Why not pause the video now and have a look at these 3 verbs, suggest, ask and tell, and see if based on that you can predict what the answer is going to be. So similarly to before, that verb ask, which is associated with proactivity and involvement, is here associated with the most appropriate answer, whereas the verb tell, which perhaps signifies a lack of listening, is associated with the least appropriate answer. So that wraps up our series on the situational judgment section of the UCAT. Hopefully now you've got a sound understanding not only of how to answer the different question types, but also of the ethical pillars that underpin all those questions.